Lean is all about putting the patient or the customer at the center of everything that we do. So when we try to increase efficiency and performance or make things better, we always want to look at it from the standpoint of what benefits the customers. So in the last 8 months or so, we've been able to train about 100 frontline staff, which is really awesome because the frontline staff, those are the ones who have the eyes and ears on the ground with the patients every day. They have a lot of really great ideas. In total, we've had a little over 50 projects that we've seen through completion, and that's amounted to about $3.5 million in savings. And so last year we saved about $1 million. This year we're looking at saving a little north of $3 million. When we first have them come to training, we make them pick up some kind of idea, decide on a project that they're going to do. So it's really awesome to see over the 3-month period of time that they're working on their project, how it develops and see it turned into something tangible that really has patient benefits. We really wanted people to know that we appreciate all of the work that they're doing on these projects, and we really wanted them to know that Shannon values the work that they're doing. And so we created the Game Changer Award to try to make a friendly competition between all the projects to see who can produce the best results.
My project was about saving time. We were using like 7 hours to do a 4-hour treatment, and I thought, wow, it's not very efficient, what's going on? So I started breaking it down like, okay, we need to start earlier. So what we did is we eliminated a lot of the front end time by hiring a biomed person. The biomed person also set up all the machines for our dialysis program. And then we also used Epic tools in order to enable the nurses and patients to get what they needed prior to coming to dialysis. In 2017 and probably up to we started doing this lean project, nurses were getting out of here at 10 o'clock, 10:30 at night. From 7 in the morning until 10:30 at night. Now we fast forward to today's time, my nurses are getting out by 6:30. So, I mean, it's just a huge amount of time that gets saved, and the patients really love it.
We were having a lot of frustration going through reports, trying to identify appropriate patients for our program. We had 6 different reports we were looking at every morning. It was time consuming to filter through all those reports, and we noticed there were even some patients that were left out. So that's why we decided to start the program. We met with the different departments, gave them the information that we were looking for, and once we figured out all the criteria that was needed, Epic was able to create a port. That's mostly how we get patients now. So we saved a lot of time, but then we're able to service more patients on our program and able to educate more patients, give them the tools they need, and any kind of social support they need.
Our project was chicken salad boxes. We had a lot of waste with our big chicken salad box that we were making. We did some quick evaluations and decided that we could limit it down to really just chicken salad and crackers without all the extra goodies we used to include. Cutting that down, we cut labor, we cut costs, and ended up saving $25,000 a year. Food, sometimes we just think of it as being such low cost that we don't think about how much it adds up. But when you consider what our budget for our department is for the year, it can be pretty significant. So we definitely didn't expect to save $25,000. I mean, I think we were thinking like $10,000 and we were gonna be happy with that. But when it all came together, it ended up being more than we thought.
I'm with case management, so we do discharge planning, but we also do what's called utilization review, which is where nurses review charts to determine medical necessity and the appropriate status a patient should be in. Our project had to do with that process and what we do when we don't feel patients are in the appropriate status. It's a company that we use for secondary referrals, and so what my project entailed was how we could bring some of that back into Shannon and have our utilization review nurses do it rather than sending it to an outside company to review. In looking at that, I thought, why are we paying somebody else to do a service that our own nurses could do? So really just kind of looking at the invoice that we got and then going in and looking at some of those accounts, I was able to realize that that was work that really we could do and we should be doing ourselves. With what we have implemented with our secondary referral process, we've had really great outcomes in that, we're not having to send as much out for secondary referral, which has saved us money, but then it's also just really made the nurses brighter and a lot sharper as far as identifying criteria and having conversations with physicians and becoming more comfortable having conversations with physicians.
So my project was basically getting the right size tablet to the patient in the most efficient way. Our computer system was choosing multiple tablets to make a dose whenever a single tablet could have been used to make that dose, increasing, the amount of pills you have to take and the cost of the medication in some cases. Originally, I estimated around $25,000 of savings, and I think it was close to like 10 or 12,000 products that were saved, which that's one less pill a patient has to take. After I ran the numbers back recently, I actually have found that it's going to be close to 40,000 actual dollars.
I'm a pharmacist at Shannon Outpatient Pharmacy. We supply medications used by the physician's offices at Shannon Clinic. So previously you could have the same drug used in 2 different parts of the clinic, and 2 different offices within the clinic were purchasing. Yet a third route might be buying it from us. So we're the same drug being bought at the same facility, Shannon Health System, paying maybe 3 different prices. But what we did is consolidated the purchasing and centralized it. They use Epic to order. We get the orders at Shannon Pharmacy, and we're able to go out there and negotiate the best pricing for the health system as a whole, instead of 3 different offices paying a different price. We saved a total of $290,000 since the project started, and it's something that's very positive because it won't stop.
I think it's a way that Shannon gets to empower their employees. So this is a good way for our thoughts and ideas to be heard and to make real change.
I think it's exciting, for one, just to see the change and see how it helps people. But I mean, to get comments too from either other staff or other patients about how they like a certain change that you made is fun as well.
I enjoy making processes better, especially whenever it's a drain somewhere in the system that somebody may not even know is happening, and it's sucking dollars away from the system that could be used to better patient care.
For someone who's interested in getting involved in this, the way you start the process is that you have an idea. That's the first place. So you need to know that there's something that you can improve, or you have an idea that you'd like to try. And if you're frontline staff, you should speak with your manager and kind of work with them to make sure it's something that's viable. Otherwise, you can submit a bright idea on our Shannon Links page, and that bright idea comes to the Lean team, and we're able to work with you to facilitate your project. We kind of give you some tools so that you know how to make a project work, and then help you see it through to completion.